friends, welcome back to my channel. Today I am going to discuss part 2 of basics in implantology. I hope you have all learned the basics in implantology part 1. Let's discuss what is all about part 2. Let's see what are the indications for a dental implant. These dental implants can be used to support any kind of prosthesis. It may be removable, fixed, full arch or segmented. And it is used for any tooth replacement also. So based on use, the primary indication for implants are partial edentulosum, complete edentulosum, maxillofacial defects and orthodontic tooth movement. When a fixed partial denture is compromised due to weak abutments, long edentulous span, cantilevers, unfavorable number and location of abutments. When a conventional complete denture may be compromised due to poor muscular coordination, low tolerance of mucosal tissues, compromised denture supporting areas, parafunctional habits that compromise prosthesis stability, unrealistic prosthodontic expectations, hyperactive gag reflex, and the patient's requirement for fixed prosthesis or psychological inability of patient to wear a removable prosthesis. These are the various indications for a dental implant. Let's see what are the contraindications for a dental implant. The contraindications may be absolute and relative. What are the absolute contraindications? High dose irradiated patients, hematologic systemic disorders, patients with psychiatric problems such as psychosis and dysmorphophobia, medically compromised individuals where surgery is contraindicated. And the related contraindications are low dose irradiated patients, the patient having diabetes, smoking, alcohol, drug abuse, children up to 18 years until the jaw bones have stopped growing, and finally pregnancy. So these are the various contraindications. Let's explain in detail. And let's discuss what are the related contraindications. Actually, these are conditions where dental implants can be placed in milder forms of the disease and avoided in severe forms of the disease. And they are HIV patients, that is generally implants are avoided in HIV patients. However, if their CD4 counts are above 200 cells per mm cube, then implants can be considered for the treatment. Then chronic lymphocytic leukemia. Implants can be considered for this treatment. However, if the disease is advanced with thrombocytopenia and anemia, then implants should be avoided. Third one is radiotherapy. Dental implants should be avoided if the patients received over 45 to 50 gyron of radiation in total. Even for those who receive less radiation, hyperbaric oxygen therapy may be recommended. Then cancer surgery. Here, secondary placement is generally recommended. And Jacobson recommended that 1 year interval is between treatment and implant placement. Then smoking. Smoking cessation protocol should be followed at least 2 weeks before implant placement. And the patient should not smoke for 3 to 6 months post implant placement to ensure complete healing. Then cardiac disorders. Recent MI to avoid the risk of infection and complication due to additional drug therapy. And unstable angina pectoris, decompensated congestive heart failure and significant arrhythmia. And also severe valvular disease. Okay. And also other systemic disorders like uncontrolled pulmonary disease, kidney disease, liver disease, endocrine disease and osteogenesis imperfecta. Severe form of this. So these are the related contraindications. To be continued, that means osteoradionecrosis, that is, if the patient's mandible is resected or reconstructed using a vascular bone graft, then implant placement can be considered. Then Paget's disease of bone. Actually, it is an idiopathic disorder of the bone. where it is difficult to achieve adequate tightness of placement. Then bisphosphonates like Aridia, Somata. Okay. These drugs are osteoclast inhibitors that produce transient increase in bone density. However, the lack of the osteoclastic activity curtails the osteoblastic activity and bone remodeling cycle. And this makes the bone highly brittle and lifeless. And also, the blood diseases that can affect healing, that is coagulopathy, anemia, polycythemia vera, thrombocytopenic purpura and neutropenia. And finally, the active malignancy. That means carcinoma or sarcoma of jawbone, leukemia and lymphoma. So these are the various relative contraindications for dental implant. Coming to absolute contraindications. High dose irradiated patients. Hematologic systemic disorders. Patients with psychiatric problems, then clinically compromised individuals where surgery is contraindicated. And also below 17 years of age, implant retards bone growth of the surrounding area and should not be used in patients under an active growth period. So that is the significance of age. And smoking and radiation, that is the dental implants should be avoided in smokers who underwent radiotherapy. These are the additional absolute contraindication. Okay. And what are the advantages of implant-supported prosthesis? Most humans are blessed with two sets of teeth, baby teeth or a primary teeth and permanent or adult teeth. When a single permanent tooth or multiple teeth are lost due to dental decay or gum disease, dental implants can now replace them as the third set of fixed teeth. And the dental implants can last a lifetime and can improve your appearance. Also your confidence, your ability to eat the foods you like and participate in active lifestyle without worrying about your teeth. And the dental implants are made up of titanium and never get dental decay. So what are the advantages of the implant supported prosthesis? First one is preservation of bone. The placement of an implant will ensure that the bone level is maintained in that region. The teeth can be positioned for aesthetics. With an implant, the teeth must be positioned where the natural existed rather than in the neutral zones for stability as dictated by traditional dentures. Then the vertical dimension should be maintained. So loss of vertical dimension decreases due to wear and bone resorption with conventional complete dentures. But implant dentures can maintain this vertical dimension as bone resorption is minimal. Then occlusion. It is easier to establish proper occlusion and occlusal loads. It can be directed better. Then mastication can be improved. That is enhanced bite force and masticating efficiency. Then stability and retention is increased. Size of the prosthesis is reduced. Success rate of prosthesis is enhanced. Coming to the disadvantages. Like any minor oral surgical procedure, there is a risk of infection, inflammation and discomfort. If there is no available bone to place the implant, then bone and gum grafting procedures may be required, which can increase the cost of your treatment. However, the investment can pay off in the long term and will be discussed prior to starting treatment. So the disadvantages, first one and most disadvantage is expensive. So it is very expensive treatment and it has prolonged treatment duration and also it involves a surgical procedure. So these are the various disadvantages of a dental implant. So we have discussed various indications, contraindications, advantages and disadvantages of dental implants. So we will discuss the next part in the next lecture. See you soon. Subscribe my channel for more videos. Thanks for watching.